Hi, aloha everybody, welcome. We're here with Maria Moreno-Chow, who is at Adventist Health Castle as a nurse, but also active duty with the Navy.
Yes, the Navy Reserves.
Thank you so much for your service. Not only do you work at Adventist Health Castle, but you've traveled quite a bit.
Yes, I have. So I've been very fortunate. I am a Nurse Corps officer in the United States Navy Reserves. I've been doing this gig now for 25 years, and I've been very fortunate because I've been at Adventist House now for 31 years. So it does go to show that my employer is very supportive of my military career. I started off as a baby nurse in the Navy Reserves back in 1994, and I have been very fortunate to move up the ranks. I'm currently at the rank of a captain, which is an 06. I've had a total of 3 years of active duty experience with my deployments. I've been deployed in 2010, 2011. I went to Kandahar, Afghanistan at the Row 3, worked in the trauma center there. In 2012, they sent me 6 months overseas on the Mercy hospital ship over in Asia, and in 2015 they sent me to Guantanamo Bay, Cuba as a senior nurse executive, which is a director of nursing services. Otherwise, recently have just gotten back from my Pacific Partnership deployment to the Marshall and Micronesian Islands.
And what is the shift between when you're doing civilian work at Adventist Health Castle and then when you go to do your military service? Is there a kind of a shift that has to happen, or is it kind of seamless for you as far as care?
I would like to believe that it's seamless. The only difference is the hats that I wear. So working at Adventist Health, working in the emergency department, I do pride myself with trying to give the best quality care possible when I'm also wearing my uniform, caring for patients, because although I am a captain, I am a leader, it's expected that I'm able to provide care for patients in any environment. So I would like to believe that I also provide those patients with the best quality care, because they're looking for us to provide that. Not only is it families, is it dependents, it's people that we see overseas, but it's our wounded warriors, and they deserve nothing but the best.
And in your travels, what has been one of the most memorable places that you've provided care for when you've been out serving the country?
So one of my most memorable experiences has been my deployment to Afghanistan. All the advances that we see now in healthcare, especially in trauma, were a lot of the principles that were learned from these patients that we would see overseas, and my experience working in the trauma bay certainly brought it home to me. I was able to bring back some of that learned knowledge to my facility, but ironically, several years ago they sent me back to Walter Reed to the Wounded Warrior Clinic, and it was there that I realized what the care, the magnitude of the care that we were doing, because these individuals that we care for in that facility are people that have injured themselves and are either waiting to be processed out because of their injuries or be cleared to go back to duty. And back then I realized that a lot of the stuff that I had seen in 2010, 2011, I had suppressed, and when I went back in 2017 actually, it opened up a lot of things that I had suppressed. Even the smell, when I came back to work in the emergency department, certain smells brought things back to me that I had suppressed. I did go look for help. I was able to seek the help that I needed at the Veterans Association, got myself involved there, and sometimes it's just best to talk about those things, and I think that that was my turning point there, just in speaking to somebody to realize, wow, you know, I'm not sure how I was able to suppress all this to carry on, but it did help. It did really, and I always encourage people. Especially in my practice, I always tell people, you know, there are people out there that you can speak to, so look for it, because sometimes we don't have to be that brave person and suppress everything. We can certainly bring it up and start talking about it. Self-healing.
Right. When you're thinking about the future and women who might want to be thinking about going into this field and dedicating their lives like you have, because 25, 30 years is a long time. Yes. What kind of, you know, advice would you give women and young women who are thinking about maybe the Navy, maybe armed services is the way to go?
Well, I believe that the military certainly welcomes females, males, and the nice thing of all is that not only do they provide you with the skill that you need if you don't have one, but they also prepare you to be physically ready, physical, agile. So that keeps you engaged to taking care of your physical self, but also it definitely allows you to gain leadership skills that otherwise you will not gain elsewhere. There's not a class or course out there that teaches you how to be a leader. Leaders come from within, but I think the military itself kind of molds you to be a leader. And I think it's a great place to start, just because that'll give you that opportunity to really to get those skills that you really need to be able to take that next step in life.
Well, thank you so much for your service, dedicated service for so long, and for reaching out and talking to people honestly about your experiences. And hopefully women who've watched this will be able to know that the path is out there if you want it to be, and that you can do these things and find help if you need it. I'm just honored that you were able to share your story with us, so thank you for being here.
Thank you.